Hello and welcome to today's webinar on healthcare-associated infections and antibiotic resistance, communication tools for health departments. My name is Elizabeth Rubush, and I'm a Senior Analyst for Infectious Disease and Immunization Policy at the Association of State and Territorial Health Officials. On this webinar, speakers will provide tips on how to use a suite of communication tools recently released by ASTHO and CDC and developed in partnership with Porter Novelli. I'll be moderating today's webinar. Our featured speakers include Meredith Allen, ASTHO Senior Director for Infectious Disease and Immunization Policy. Meredith will provide a few welcoming remarks and an introduction from ASTHO's perspective. Following her, we'll have Elizabeth Mothershed from CDC's Division of Healthcare Quality Promotion, who will share a brief background on this work from CDC's vantage point. And our final speaker will be Jana Thomas, Executive Vice President at Porter Novelli, a communication and social marketing firm. Jana will walk us through the suite of communication tools and provide tips on how to use them to reach audiences in public health, healthcare, and the community. Before we get started, there are a few housekeeping items to cover. We welcome your questions. Please submit any questions or comments you have via your chat window, located on the lower left-hand side of the webinar screen at any time during the presentation. Questions will be addressed after all presentations as time allows. To ask for help, please press the raise hand button located on the top left-hand side of the screen. This will allow you to chat with the meeting chairperson for assistance with any technical difficulties, etc. during the webinar. To hear audio, please ensure your speakers are turned on with the volume up. The audio for today's conference should be coming through your computer speakers. In addition, the speaker slides will be provided to participants in a follow-up email. Today's webinar will cover the background and purpose for creating these communication tools from both ASTHO and CDC's perspective. We'll then discuss project goals and the methods used to develop the tools. We'll provide a high-level overview of the suite of resources and then take a closer look at the communication toolkit and supporting materials, which include an infographic, info cards, and an animated video. Finally, we'll have a question and answer session where you'll be able to submit inquiries to our presenters via the chat box option. Now it's my pleasure to introduce our first speaker today, Meredith Allen.
Good afternoon, and on behalf of ASTHO and our members who represent the chief health officials across the state and territories, I'd like to welcome you to today's webinar. Supporting public health infrastructure and enhancing outbreak investigation and response are among ASTHO's core priorities as an organization. In particular, our members have identified addressing healthcare-associated infections and antibiotic resistance as key areas for immediate attention. Healthcare-associated infections represent a significant cause of illness and death among U.S. patients each year, and state and territorial health departments have a critical role in engaging partners across healthcare continuum to prevent and respond to HAIs. ASTHO is committed to supporting health departments address healthcare-associated infections and antibiotic resistance. In partnerships with CDC, we've advanced this work through a range of activities, including collecting and disseminating best practices, convening stakeholders across sectors, awarding capacity building grants to states, and raising awareness about the value of public health in preventing and responding to HAIs. To address this last point specifically, ASTHO and CDC, with support from Porter Novelli, have developed a new suite of communication tools geared at helping public health departments raise awareness and take action on the seriousness of HAIs and antibiotic resistance, proven prevention strategies, and also helps to articulate the value of public health and the importance of working across sectors to address this issue. ASTHO is indebted to the support of CDC National Partners and our members in championing this work. We're committed to continuing our support of health departments in addressing and responding to HAIs and antibiotic resistance, and we thank you for your participation on this webinar today.
Good afternoon. I'm Elizabeth Mothershed, lead for State Strategy and Integration in CDC's Division of Healthcare Quality Promotion. I'm going to provide some background to help set the stage for the rest of the presentation. The need for integration and coordination between public health and healthcare has become a critical issue over the past several years. For preventing healthcare-associated infections, or HAIs, especially those caused by antibiotic-resistant pathogens, that integration is essential and depends on effective communication. Since 2009, CDC has supported state and local health departments to build programs dedicated to the detection and prevention of healthcare-associated infections. However, the 2014 Ebola response highlighted the critical need for improving infection control practices in U.S. healthcare and called upon CDC and state and local health departments to work together in unprecedented ways. At the same time, CDC was leading the charge for increasing national efforts to improve antibiotic use and combat antibiotic-resistant infections, which are responsible for thousands of deaths every year in healthcare. To address these significant needs, in fiscal year 2015, CDC funded HAI-AR programs to assess infection control practices in hospitals and other healthcare settings, to identify and help close the gaps in infection control, and to provide consultation and assistance for using available infection data to target prevention efforts. This past year, in order to implement the National Action Plan for Combating Antibiotic Resistance, CDC again provided significant funding to state HAI-AR programs for improving detection and containment of antibiotic-resistant threats, enhancing national laboratory capacity for antibiotic resistance testing, promoting the appropriate use of antibiotics, and accelerating prevention efforts, all in partnership with the healthcare community. This rapid scaling up of HAI-AR programs and the increased demands for collaboration around these important and complex issues requires that public health be able to communicate their role clearly and with many different types of healthcare partners through a variety of outreach strategies. Communication between public health and healthcare sectors can be challenging for many reasons. For years, public health and healthcare operated very separately from each other. For reasons such as regulatory oversight, having different approaches to and reasons for infection surveillance and health data management, differences in terminology and in culture, public health and healthcare don't always speak the same language. The common goal that we always come back to, however, is providing the best possible care to protect patients from getting infections and to save lives. Public health HAI-AR programs are uniquely positioned to help drive strategic direction for prevention through their HAI advisory groups and their HAI state action plans, by promoting awareness and education about the threat of HAIs and antibiotic resistance, and about the need for strong infection programs, and by using available data to target infection prevention and outbreak control efforts in coordination with their healthcare and community partners. The tools you will see today were designed to fill a need that we have heard from HAI-AR programs around the country. In order to build strong, effective partnerships with other public health agencies, with healthcare partners, and even with policymakers, we need to be able to articulate the role and the value that public health brings with clear messages, with a focus on stopping the spread of resistant threats, improving antibiotic use, improving infection control practices, and protecting patients. We hope that these tools will help equip you to do just that. And now I'll turn it over to Jana Thomas, our partner at Porter Novelli, who will walk us through the tools.
Thank you, and good afternoon. As Elizabeth said, CDC and ASTHO have worked together for several years in order to take on an initiative to reduce healthcare-associated infections and antibiotic resistance. So our goal in this effort was, how do we take what we have learned about communication and apply it to communication work, so that all the progress that had been made so far could actually be scaled and taken to a more national level, so that we could work towards broad-scale awareness and adoption. for us from the communication perspective, we look at this as a process. So we started with laying out to move people from awareness to engagement to conversion to champion. For the awareness was understanding and looking to see, all right, what are people saying? How aware are people of not only the issue of how severe it is as a public health crisis, but public health also has a role to play. What is the conversation around how this needs to move in order for us to move the needle on HII and AR resistance? From awareness, hopefully you're doing it more for just awareness' sake so people know, but it's an important component of it. Moving next to engagement. Once people are aware of this issue, how do we get them to actually engage? And in this case, it is the building that relationship, as Elizabeth said, between public health and the healthcare delivery system, between the people in the community who are making these decisions within facilities to consumers as well for what they could be doing, and looking at the entire spectrum of people who have a role to play, and then how public health fills the role in that and coordinating and moving that forward. The third is conversion. So what do we do to motivate target audiences to take action? And one of these is really getting them from aware of the issue to motivated to doing something. And then the last step is that champion. And we a lot of times think about champions and people who are just really love what we're doing, but we're looking at this more than just having an affinity and really knowing that this is an issue to move forward. But how do we get the champions within the public health community that really want to serve that integral role of coordinating all of the players in the community that are really important? So it's champions not only to raise awareness of the issue, but to drive those key collaborations that are important to make a difference on this issue. With that in mind, we laid out these are what we're trying to do with our communication objectives. What's the next step for us is, well, who do we need to speak to? Who are the people that are key actors in making a difference on this issue in the community? And we looked at the target audiences and identified two kind of major buckets of where the audiences fit. One is on the long term, who are ultimately trying to change the behavior and get involved in playing a role in this, is the public health professionals, healthcare facilities, and the general public. But we also recognize in this work that going directly to them is going to miss a key component of what we should be doing and who we should be working with on this. We really needed to spend time coming up with the messages and the materials and the content to help people who are driving this in public health to have a conversation about how public health is important to this, what they should be doing, and how to activate the other people in the community. So we identified an end user audience. And where this plays out when we show you the materials going forward, the materials are designed for the end user. They are for the state, territorial, local health departments, the people who are driving this at the community level, to have what they need at their disposal and these resources available to carry on the conversations that go forward. One of the things that we're interested in, if people want to think about as we're talking through this presentation, is there particular audiences that you have in mind that that are not included here, or that you have different ways to identify who they are. If you can think through, like, who are your target audiences and who would these materials be applicable to in your community, we'd love to hear from you. So with our campaign objectives and communication objectives in mind, and knowing who our target audience was, it was really important for us to not make assumptions and not try to think that we by ourselves could do this on our own and had all the answers. So we went through a regimented research process in order to get feedback and input throughout this entire process. And I say feedback and input because a lot of times it was input. How do we design this? And then showing it to other people to get feedback. So looking at both points in time. We started off with a peer review articles and news articles and social media posts. So we started with really conducting a landscape assessment. What are people talking about? What are the things that are being published? And looking at social media so we could see how it's translating into that consumer audience. And some of the things that we've learned there was a lot of public health departments are really active on Twitter and really using some of these social media outlets to reach consumers. We also learned that public health that are using social media are really high users of retweeting and sharing content from one site to another, and really trying to find content that is easily shareable and realized from that, like, what can we be doing in order to make it really easy for people to post, knowing that if we can get one post out, there happens to be a ripple effect within the public health community, which is phenomenal. We looked at news articles that were both direct to, like, the consumer, what you think of as more mainstream, but also the trade publications. So how are people talking about this in all the different areas where communication HAIs occurs, and the peer-reviewed articles. And this really laid out the landscape that Elizabeth mentioned earlier. There is a lot of information, and there's a lot of stuff published on HAIs, but there was not a lot that was about communication. So there were not a lot of tools or materials that were really available to help people understand. People can understand deeply, but not a lot of tools to help people understand and communicate simply. And that is one of the key things as we try to broaden our message and get more people involved in it, is taking it out of our mindset, because I'm assuming a lot of people in the webinar are like me, a little bit of a public health junkie, and you like to know every detail and know every why and explain things in a completely comprehensive way so somebody else understands as much as we do. We certainly have passion, and what we were trying to do in this is figure out how do we translate that passion to get more people behind it. As we were developing the materials too, we took this landscape assessment and started making some assumptions and educated guesses on where we needed to go with the materials. But again, did not rely on ourselves to do this. We wanted it to be really materials for the community, developed by the community. So we did some key informant interviews to get some input early on about what the needs were and how these materials would be used. So we thought not only about the messages of what we needed to say, but how do we create the right content and format and pieces for channels that would be helpful for you once you get this. Because it certainly doesn't do a whole lot of good if we give you a list of key messages and you look at them and say, well, what am I supposed to do now? So thinking about all the different ways that broad-based communication happens and how do we fill that need so the tools are not only informative but very useful to you. And then we did several rounds of focus groups with people at HAI-AR meetings so that we could show them early drafts and get feedback and refine them, and also the latest iterations of them before we went live, made significant edits again, so we continued to refine these based on what we learned from the group of end users. It's really important to us that we have considered not only content but also utility. From all of that research, we were able to really focus on 4 major areas of content and form and function. So we're going to go through each of these, and I hope that what you are able to take away, and certainly if you have questions along, putting them in the chat box so we can answer them at the end, thinking about how you would use these in your daily life so that they're not something that you get and say, oh my gosh, these are really pretty, and put them on a shelf and don't ever find them to be useful. Our goal was to figure out different forms and formats to make them as applicable to your needs as possible. So with that, we have a toolkit, which is very robust, a lot of information and we'll go through it specifically to help you figure out how to have and conduct these conversations and build those champions and others in your community. So this one really is designed for as we said, the end user, but that champion who wants to go out and get more people involved and more people engaged and really highlight this as an issue. And then we have pieces because we know when you go out and talk to people, it's not only the messages in your head, but what can you hand people and what can you show them that makes it really explicitly clear from their needs, their point of view, how this is relevant to them. So we have an infographic, we have a series of info cards, and then we also have a video, because the video gives us the opportunity to be able to tell it for the people who are like to watch something and see it in a very robust way, to tell an entire story in a short form, as well as having written materials. So one of the first things that we had made sure as a team that was available was through the ASTHO website that there was a place on the web, so there was a dedicated place we could send people to. So every place had the materials, everything had a home where it was organized, and we could go out and say, for more information, go to ASTHO, and you will be able to find the toolkit and all the materials. And you can see just a screenshot of what the website looks like. Everything that we have and are speaking about today, you can easily get from that website, and that was mainly the point of it, making sure there was a resource available to you to be able to get these materials. As I said, the biggest most robust piece that's available on here is the toolkit. And there's a lot of information even on this slide because there's so much in it. It takes a lot to be able to convey what all is in the toolkit. But it includes resources and templates that really help people who are trying to navigate, all right, how do I get this story out of my community? What are the resources that I need? What are the skills that I need? So it attempts to try to answer both of those questions at the same time through the different resources that are available. They are designed so that they can be used across the broad scale of people within your community. Hospitals, facility leaders, patient groups, patients, the media, and all the materials are customizable, and we'll go through that as well. We go through the materials. We're going to go through, at a high level, the 6 major buckets of materials that are included in the toolkit. We have key messages, tips for working with the media, how does it stay in the conversation about HAI prevention, social media guide, calendar of events, and supporting resources. And I'll walk through each of these in a little bit more detail for you. So the first part is the key messages. And the key messages were designed for the specific question. I work in public health. I really understand this deeply. How do I go out and talk about this? And one of the things that we saw clearly from the environmental scan and from hearing people, figuring out how to tell this story in a consistent way. And consistency is important because, as we all know, policies may live within geopolitical boundaries, but the issues and the outbreaks don't. So how do we make sure that across the board we're actually not only building awareness within our local community, but that it elevates up to the statewide and national, because sometimes those boundaries don't exist, and being able to build the case, the strength comes from our numbers. So how do we use our numbers positively? And one of the ways is making sure we have a clearly articulated story that we all agree upon. Getting to this, probably the talking points was where a lot of time and energy was spent, because getting these right is important for every other material that you see. We put these in the messages in 3 major buckets, and you'll see when we get through the key message points, if you go download the toolkit, is how do you build a case? How do you get people to know that HAIs and AR is a serious threat? Some people, and we've talked to communities, you see a lot of media attention happens when the threat is raised, when there is an Ebola outbreak or something of that nature, when there's any threat. But we need people to understand that this is more than just an episodic reaction. And part of that comes from helping raise that sense of risk or raise the sense of the severity or impact of this. The second area for the key talking points is the role of public health. What public health does, and its importance in not only monitoring, but also coming up with those policy solutions and interventions. That public health, through the time of being able to study these and have tracking networks and everything else that comes with the wonderful epidemiology that's done at CDC and the work that's done at ASTHO and through all the health departments, that we're able to know what actually works best and what are those evidence-based interventions. And then the third part is, once people know, all right, it's serious, I need to pay attention, public health is on it, what can I do to help? Because we certainly don't want this to be the whole entire burden of HAI and AR prevention is in the hands of public health. Public health plays an important role in helping other people understand clearly what they should be doing. So the talking points follow into those 3 major areas. Talking a little bit about how to use these. When you look at the toolkit, there are the 3 buckets, and then there are tons of supporting points. And the key part of figuring out, and we'll talk about it a little bit when we get to the media, is pulling out the points that are right for your audience and then putting them in your own voice. So you don't have to read them as you have read them in the toolkit, but how do you look at the array of information that's offered, the simplicity of those messages, and fine-tune them to tell the story that you need to tell. So they're designed to be a very robust structure so that we have consistency in how we tell the story, but they're also intended to be fluid enough that you can pick them up and make them your own. A second component of the toolkit is working with the media. Now, I know some people on the phone may be really old media pros, and some people may not ever interact with the media at all. There are certainly different arrangements within health departments and public health, where some people don't even have the ability to speak to the media, it's handled entirely by the Department of Communications Office. But I would argue that when you look at the toolkit, these kind of guidelines are important for you in thinking about how do you speak with the media, but also how do you talk about it if you have to do a presentation, if you're doing a speech to a local community group, or if you're having a one-on-one conversation. The rules and the tips actually apply regardless of, if anytime you're trying to get somebody outside to care about this and do something, that these tips are still really relevant. Being to know who your target audience is. You certainly talk very differently if you're going to speak to somebody within public health and you're trying to get them to work with you and they're certainly aware of public health policy than if you're going to the Rotary Club and you might want to make a little bit more of a business case. But thinking about who your target audience is really important. Shaping your angle to fit that audience because your story might be a little bit different. And while the core of it's the same, understanding the end, how you start that conversation and what the payoff is and why that person or that group or organization should care is really a way to think about how do I talk about this, what lens do I bring to this so that it meets their needs. We encourage people to do your homework. If you're thinking about talking to the media, knowing what they've written before and what their tone is and what their journalistic style is. Again, I say that's true no matter who you're speaking to, knowing their background and what their expectations are actually makes you much more effective in your communication. We have in here to localize your story, and this will also play out when we talk about how you sustain this. Figuring out why it's important to you locally carries more weight when you're trying to build those local collaboratives or local initiatives, when people realize what it means to the local community versus having national statistics. So figuring out, are there certain pieces of this that are really relevant to my local community, my region, my county, or the area in which you work. We also encourage people to use social media to amplify your message. And then if you are doing media, making sure that you identify and prepare a spokesperson, knowing who's going to be delivering the message and that they're equipped and prepared to do so. Another section of the toolkit really focuses on how do you think through several different ways to amplify the story and to get more people engaged and really get more coverage outside of those epidemic, episodic moments in time. We heard very clearly in the interviews that we did leading up to it and throughout when we were showing the materials, this is a real need in the public health community is to get people to care during the intermittent times between episodic outbreaks or things that come up, because that preparedness actually needs to happen during those times, and people need to be concerned during those times where unfortunately there are no bad incidences. So we have tips on how to do that, like leveraging relevant events, sharing data, share your success stories, and connect media to patient advocates. These are different ways to think about, instead of having one straight story or going out and talking to a group, it's important, it's important, it's important, finding different ways to tell the same story to bring a different breadth of life to it, which could be making sure that if you have a program and you're implementing it, that routine times throughout the year, that you're sharing the success stories and not waiting for the 5-year epidemiological data to come out and is published 2 years later and feeling really comfortable. Finding those milestones and going out and saying in the interim time, here are some of our success metrics and how we're making progress, so that you have a reason to talk between those major milestones. And finding different things like patient advocates and those stories of prevention and successes of being able to think a little bit differently. Sometimes we believe that we have to have the full problem, solution, success, and proof, and that's not always necessary. So how do we go out and say, in the interim time, here are the little successes. Here's a patient who had an experience that was great. Here's something that we did with collaboration with the hospital, and we're all thinking a little bit differently and talking about those things that are not complete. And it's okay, because it keeps the conversation going, and the goal of this is to have people come along the journey with us, not just celebrate when we're finished. We have the same, and there's information there on social media guide. As I said earlier, like there are some public health departments with really robust social media platforms. So we've put in some sample tweets and designed not only to make you sit and type exactly what we wrote, but to think about different ways and different conversations and how to use tweeting and Facebook in order to generate a lively discussion and making it relevant again to your community and what's going on with your own initiatives. We included a calendar of HII-related events because we, in public health, try to find ways to make these relevant and give us that timeliness and those prompts of reasons to go out and talk to people. So making sure that you're aware of not only ones that are completely on point with what you're trying to do, but things like the National Blood Donor Month or areas. It's opportunities to go and talk about the importance of these issues. And then we have resources. So additional resources on HIIs, antibiotic resistance, and risk communication conversations. So that is a toolkit. As I said, it's really a robust tool, and what it's designed to do is to help equip people to know how can you go out in your community and knowing that you're backed up by the resources in order to be very bold and adventurous and try to have conversations. We complemented the toolkit with other pieces of information that are designed more towards the end user audience, or the people that you're talking to audience. So those in the broader general community, whether they be the general public of individuals, or if they're policy leaders, business leaders, the healthcare facilities, all those different groups that you need to bring on board to think through how do we give you the right tools that you can go and have the conversation, have a leave behind, and have the person be much better educated on these issues. So the first thing is an infographic, and this one really is positioned to talk about the role of public health and why public health is important. And in reading it, it is not only why public health, but you also pick up what the other people need to be doing. So public health is important because we help all of these other pieces come into play. So there is the overt message, and there's also the subtle, so that other people seeing it can read it like, yes, public health is really important. They're coordinating a lot of really important work. But also here's where I fit in a little bit. So starting to allude to that conversation that there's a role for everybody, and public health needs all these different voices in order to have the impact that we want it to have. Again, this is, it's available online. It can be printed. It's also designed in a way that you could screen grab and share it on social media and be able to find multiple ways to use it. You can use it as a visual graphic on social media, but then do call-outs with individual messages. You can put it in the 6 things and have 6 different social media messages, and really use it as a visual graphic tool to bring more interest to social media posts. Another piece of material we designed was an info card series, and there are actually 6 of these. And these were designed to answer a very specific question we heard a lot. How do I tell people what we want them to do? And what actually do we want people to do? How do you have this conversation? Because telling a consumer, I need you to, think about antibiotics, complete the bottle. I want you to do all those, wash your hands, all those things that are really important for the prevention of the spread of germs and HIIs. But there's also a very different story for doctors. And there's a different story for people who are responsible for patient safety in a hospital. So coming up with one list of messages that apply to everybody is rather cumbersome and not all that helpful at times when you want to be able to go directly to a particular group and tell them, this is how you can help. Here's, not only do you have a role to play, but these are very specific things that you can do. And so these are very high-level information, but very action-oriented. So we have the 6 different ones, the role of hospitals and healthcare audiences as it lays out, as you can see on the slide, patient care providers, doctors, executives who are making decisions about the regulations and policies and procedures, environmental cleaning and administrative staff, infection preventionists, and patients. And again, these can be shared online, they can be printed, and they also leave room for customization if you wanted to add your own logo to them, that there's the ability to do that so that they do know that in addition to the power of having a credible organization behind it with CDC and ASTHO, that they're localized, and that actually carries a lot of weight with people who are trying to use the materials and just know that it's their local health department that's involved in it and is behind them. The last material that we have to mention is the animated video, and it's one I strongly encourage you to go to the website and watch. It's, as you will see in all the materials, we really tried hard on the design and on the words to keep it light. And I don't mean light from a heavy burden, but visually light, to feel like this is something that I actually can do and not be overburdened with both words and imagery and anything that's dark. So this one it raises the awareness of the severity of the issue, but it feels very action-oriented. There is something you can do. There's a role for everybody to play, and really drives people towards understanding that it is important and that there's something they can do, and a very compelling and short way to get the entire story that I think is really compelling, and would encourage you all to go and take a look at it. Again, it's designed to be able for you to share in presentations, and you can also put the links to and promote it through your social media channels. And I think 25 minutes left for questions.
Thank you, Jana. And thanks to Meredith, Alan, and Elizabeth Mothershed for sharing their perspectives on this work as well. So at this point, we have some time for questions and answers. Remember, if you have a question for one of our speakers, please submit them via your chat window located on the lower left-hand side of the webinar screen. And we've had a few questions come in already, or comments as well. So the first two are talking a little bit about the Ebola crisis. First comment is that the local wastewater collection and treatment system are also an important stakeholder and must become aware and remain engaged. They are the next exposed community beyond the healthcare system. This type of interaction with engaging the local wastewater collection and treatment system occurred during Ebola and should continue with day-to-day HAI, AR work. And the second comment is that during the Ebola crisis, the University of Nebraska had been very proactive in getting information out to the public and making sure that the public was confident in the biocontainment system and the capabilities of their personnel in protecting the public. Others were not as proactive and were less successful in getting the public behind them and the patients that they were treating. These tools will be instrumental in getting the information out to the public and ensuring their support. So Elizabeth or Jana, do you have any comments about these tools in the context of the Ebola outbreak that we were looking at in 2013-14?
Thanks, Elizabeth. Yes, and I think this is Elizabeth Mothershed from CDC. I think those are excellent comments, and certainly we couldn't cover the breadth of partners within this presentation. I think being able to use these tools and adapt them to a specific situation is going to be key, and I think the health departments probably and healthcare facilities are going to be best positioned to know how to use these tools in given situations. But certainly the Ebola crisis highlighted the complexity of containment within that response. And so the comment about wastewater and waste disposal obviously became, a significant part of that conversation and that response. And so for public health, partnering with their preparedness colleagues within the health departments, as well as with the environmental safety and control professionals within the healthcare community, was key during that response. And so using these tools to reach those and other partners, I think will be important to continue to do, to raise, continue to raise these issues, highlight the importance of the connectedness between public health, healthcare, and the environment. So that was an excellent point.
Thank you. We also have a question that's specific to the tips for working with the media. Can you provide a little bit more clarification around what it means to shape your angle?
Sure. So in shaping the angle, in every media outlet, a story has a certain point of view that it's trying to put across. So in some places, in order to think about how you shape your angle and how you tell your story, is what is the point of view that you want them to have as a result of seeing the story. So in some cases, it might be your angle is totally how do we get people to care about prevention when there is not an outbreak? And you craft your story around, all right, that is the thing that I want people to know. So I pick the right talking points, I come up with the right examples, and come up with a metaphor or some other illustrative piece that really gets people to understand. I want to talk about prevention and what that is. You could have another story with the angle around, this is a community, a collaborative effort, and I want to have a media story that's really about this unique partnership or this work that we've done in our community to really advance this. And the angle of that story is around collaboration. You could have an angle around how severe this is. If you had a patient that had an adverse outcome or somebody who had triumphed over an adverse outcome, the angle of that story really is heightening people's awareness of how severe this is and why we need to do something. There's so many components of this story overall to get people, one, to realize this is serious, and what are the stories that help us understand that the seriousness of this issue. The second being that, you know what, public health is doing, serving a really important role. How do we get stories or think about a point of view or perspective that highlights the role of public health? And then something you can do about it. Certainly there are ways you don't want to go out and say, this is really horrible. These things are really, really significant in our community. There's nothing you can do. You may want stories then that complete the entire tale by saying, here's what people can do in order to protect themselves, in order to protect their community, in order to make sure that we're all living to the best health possible in this regard. And so how do we come up with a media story that's really anchored in everybody has a role to play and here's yours. And those are all really different angles, but they're all core components of telling the story. But it helps us think about it. How do we not just get everything out in one media hit or one time? What are the different ways that we can tell the story? And then how do we measure that, put that out in a measured pace? So we have something to talk about now and a few weeks from now and after that, and tell it over the course of time so that there's this sustained effort and more of a drumbeat of media attention through those relationships versus sometimes we feel compelled that people need to know everything with our one shot, and really trying to figure out what are the different angles, what's the point of view. And then when you do your media relations, if you know the point of view or the angle that you want to take to it, that you have your facts and your story so that you keep it on point to that point of view to the greatest extent possible without trying to get too far afield or letting the reporter take you too far afield from your point of view. And if that didn't answer the question, please chat a response, and I'm happy to follow up.
Thank you, Jenna. We have a question from a public health perspective. This person has come up against providers not wanting to be informed by the health department on how to manage disease. Are there any recommendations on how to address the issue of intellectual territory?
So this is Elizabeth Mothershed. I think the question sounds like it's around how, again, getting back to the issue of how to clearly articulate the value of public health versus the role of potentially the clinician or the patient care provider. And so I think a lot of those messages are embedded throughout these tools. I mean, some specific examples that public health can refer to is, having awareness at a regional level about the data within a state or jurisdiction. And so that is a way that public health can really leverage its position. For example, to understand and be able to communicate around the antibiotic resistance, percent resistance that is going on across the state or across the jurisdiction. These are perspectives that healthcare facilities may not always have, but I think are critical for public health to communicate, that are of value to public health facilities so they can understand sort of where they fit within the bigger picture. So I think that's one way that public health can shape those conversations to really articulate the value from the public health jurisdictional perspective.
Thank you. We have a question asking if our speakers could comment on how folks in public health can use the toolkit when they're publicizing their annual HAI surveillance data reports and the national progress reports. For any thoughts on how these tools could link up with the release of those reports?
So the HAI annual progress reports are in and of themselves sort of formatted in an infographic type format, at least this past year. That was the way they were released. So I could certainly see any of those materials being embedded side by side with some of these materials. So for example, if a health department wanted to highlight their progress in CLABSI reduction or their progress in MRSA reduction, they could show those data from the HAI annual report and then tag along some of the messages from this toolkit in a social media post. So that might be one example of how you could use those two communications tools to complement one another.
Thanks. We have a few questions about schools and how they can get involved. How are schools responding to infection control and exposure in the community, and how can they get more involved in this area?
So I think one way that could happen is through linking with the relevant departments within a public health, within a state or local public health system. So we at CDC have found that collaboration within the agency is key to really amplify a lot of our messages. And so I think the same could be true for connecting within public health at the state or local level. So the HAI and AR program might reach out to the public health program that most closely deals with immunization communication, for example, within the school systems, and make sure that those messages are aligned, so that when those public communications and events happen, often there are road shows and that sort of thing that public health does through the school systems, or even with the boards of education within the state. Those would be opportunities to align some of the messages and ensure that the critical components of preventing healthcare-associated infections, immunization, safety, and combating antibiotic resistance are woven into those messages with those opportunities to interface with the school systems and with the education systems within the state or jurisdiction.
Thank you. We have a question about animal agriculture, asking what links exist to connect local public health departments with emerging disease issues in the agricultural sector.
So CDC has a lot of information. If you go, there was a link on slide 9, I believe, cdc.gov/drug resistance. The Antibiotic Resistance Solutions Initiative from CDC addresses not only antibiotic resistance in healthcare, but also in food and agriculture. And so there are a lot of resources on CDC's website that address antibiotic resistance in agriculture. Likewise, I would say that there are many health departments that have put a lot of time and effort and energy into, again, forging those collaborations to address antibiotic resistance broadly within their state, and looking at how healthcare and food and agriculture and the environment all interface. This is sometimes referred to as a One Health initiative or One Health approach. And there are many states that have a lot of really good information and resources about the interplay of antibiotic resistance between healthcare, agriculture, and the environment. So I would suggest those as good ways to understand more about AR and agriculture on its own, but also importantly that interplay between healthcare, food and agriculture, and the environment.
Thank you. We have a question as to how health departments can add their logo to the toolkits and other materials.
So The materials are available on the website and they're PDF and they're editable. So you can go, we made sure that there was space within the parameters of where the materials are and the logos where the CDC and ASTHO logos appear, that leaves room for you to be able to insert your own before printing.
Thank you. What information would you recommend to educate healthcare aides or personal support workers in long-term care or providing community care?
So I think a lot of these tools could be used as they are, but again, getting back to shaping your angle, really talking about kind of using them in a framework that speaks to the audience you want to address. So many of the principles and the messages about good infection control and antibiotic use and combating antibiotic resistance are true across all healthcare sectors, and so certainly would be applicable to use these messages to a long-term care audience. I'll also mention that CDC has, speaking of antibiotic stewardship and improving antibiotic use, CDC does have CDC's core elements of an antibiotic stewardship program for nursing homes that's available on our website. So that may be important, again, to reference and also potentially use some of that messaging side by side with some of the more some of the broader messaging for preventing HAIs, so that people understand the connection between improving antibiotic use and reducing or slowing antibiotic resistance.
Thank you. We have a question from someone who indicates that they're new to working at a state health department and they have access to a lot of data. They created a state antibiogram for 2014-15, but doesn't know what story to tell with the data. For example, this person isn't sure what organisms and antibiotics to include in the state antibiogram regarding CRE. Are you aware of any resources that can help state health departments about the types of stories they need to tell using their data?
So I think it's always important to focus on prevention efforts. And so in as much as you can talk about how you are using your data to target prevention within your jurisdiction, I think that's always the most important message to tell. So understanding your data and collecting your data in and of itself is a critical activity, but you really want to be able to articulate and communicate how you're using those data to tailor prevention efforts. So in the example of CRE, if you have antibiogram data or you have specific information about the percent of CRE or how much CRE infections you have within your region or jurisdiction, I think the important message would be to talk about what are you doing to prevent or control CRE within your area. So I think tying the message of using the data for prevention is always the key message.
And I worked once with an epidemiologist on infant mortality, and it was one of the most interesting exchanges I had because it was this long report and had lots of great data, and at the end of her presenting the data and trying to figure out how to communicate it, I asked her, well, how do you want people to feel after they hear your report? And she goes, nobody's ever asked me that question before. And I said, well, do you want people to be angry? Do you want them to be empathetic? Do you want them to feel that there's something they can do and they feel very empowered? Figuring out the emotion that you want people to have will help you figure out, how do I tell that story? How do I look at my data in a way that puts a little bit of emotion, which will help you, all right, do I go to the prevention story, but from the angle of the data tells us, this lays out this picture, but there's something that we can do. I want people to feel empowered. Or I want them to feel overburdened. So you tell the same story, but with a little bit of oh my gosh, this is really severe. And just spending some time thinking, okay, what is that emotional response I want from people will help you figure out the packaging around the story as well as what the data tell you to say.
Yeah, that's a great point.
Thank you. So we have a few questions about use of these tools. The first is, can these tools be used outside of the U.S.? And the second is, Can groups other than public health departments add their logos to the materials, for example, universities?
Absolutely, yes to both of those questions. If they are used as certainly applicable, if they're written in a way that I don't believe they would have any type of cultural competency issues, so they could easily be used outside of the U.S. And adding other logos from universities is certainly an appropriate and a very credible thing to add credibility to the materials. That would be welcomed.
Thank you. So we have a question from a biosafety outreach officer who's in communication with diagnostic health labs. Do you think that the toolkit, especially, would be transferable to help with communicating about biosafety in the mitigation of laboratory-associated infections?
So I think it's an excellent point. I mean, I don't know that we necessarily had that audience in mind. There are a lot of particulars around biosafety and the safety in laboratories and control of transmission within a laboratory setting that I think is pretty different than what these tools were designed for initially and the intent for these tools. But that's not to say that some of the messages about infection control and using proper PPE protection and protection of the laboratory worker, those are all messages that I think, could carry over into that environment.
Thank you. And we have a question about the role of medical laboratory scientists in HAI management. What's the role of medical lab scientists?
So I think some of the issues, again, about, so a couple of things. I think the communication between the laboratories and the healthcare facilities, as well as between laboratories and the health departments, is key. And so, sharing of data where it's appropriate and possible, I think, is a key component of the network between public health and healthcare. But I think if the question is asking more about preventing transmission of infection within the laboratory setting, again, that kind of gets back to the previous question, and using good precautions within the lab setting that are specific for that setting. So I'm not sure which, kind of what the question is getting at, but I think both of those are critically important.
Thank you. And one last question to round out the webinar. We have a question about how one can get involved in helping improve HAI prevention on a regional or national level.
So I think, one obvious way would be to visit the CDC website. There are a couple of links included in the webinar. ASTHO's website certainly has a tremendous amount of information as well. So in terms of educating yourself and being able to repeat and amplify some of the messages, I think any individual can do that. CDC has a lot of tools and resources to understand the Antibiotic Solutions Initiative. There are other materials, infographics, and such that are available on the website as well. In terms of getting involved at the national level, I can just say that CDC has a variety of fellowships available. I'm not sure if that was, what the question was getting at, but certainly there are a variety of ways that, students or others can have opportunities to visit CDC, participate in CDC efforts through that means.
Thank you so much. And thanks to our audience for chatting in their questions. That's all the time we have for answering inquiries today. Please stay tuned for a follow-up email that will include the PowerPoint slides from today's webinar, and we will be posting a recording of this webinar online. Finally, we'd appreciate it if you took a few moments to complete a quick webinar evaluation. The link is up on your screen and will also be shared after the webinar. Additionally, we'd like to hear from you on how you're using these materials. Feel free to contact us with additional questions or feedback at patientsafety@cdc.gov or infectiousdisease@astho.org. Thank you for participating in today's webinar.